guys. My name is Dr. Tim Jackson, and the name of my talk, or the title of my talk, is Mitigating Mitochondrial Mayhem: How to Make Every System Work Better. I titled my presentation in such a way because every disorder has a mitochondrial component. Sometimes it's direct, sometimes it's more indirect, but we know that all cells except for red blood cells have mitochondria. So some quick learning objectives are: what are the mitochondria? Why are they important? What is mitochondrial dysfunction? How does it present clinically? What environmental and nutritional changes can we make to improve mitochondrial functioning? And what supplements may help, as well as what tests may lead us to diagnose or go down the pathway of mitochondrial dysfunction. So we've all learned in school that mitochondria are the batteries of the cell, and that's true. They do produce ATP, but they're also a signaling system, an entire signaling system, and they're responsible for the cell danger response. So they're able to function as antennas, and this is one way that non-native EMF fields damage the mitochondria, is they produce excessive reactive oxygen species, which in turn damage the mitochondria. So we know about ATP production. ATP, those phosphate bonds are high energy bonds. Iron and calcium homeostasis, they play a role in that. And coordinating apoptosis, which the last presenter mentioned, or programmed cell death, as well as the cell danger response. So if we have a lot of stealth pathogens, mycotoxins, heavy metals, the cell danger response is something that becomes active to signal danger to the immune system, and that downregulates or decreases the production of ATP. So that's why having stealth pathogens, that's one of the reasons why it leads to fatigue and cytokine-induced sickness behavior. So let's operationally define the difference between mitochondrial disease and mitochondrial dysfunction. So if you speak to an allopathic doctor or provider, they're most likely going to refer to mitochondrial disease. And that's typically diagnosed with a muscle biopsy, and it can be due to a congenital issue or a spontaneous mutation. Mitochondrial dysfunction is simply damage, cumulative damage, due to increased oxidative stress and free radicals, excessive glucose, seed oil consumption, environmental toxicants, and stealth pathogens. However, the therapies to improve both conditions or diagnostic labels are essentially the same. So mitochondrial disease, I mentioned, the primary way we diagnose that is muscle biopsy testing and possibly a cheek swab test. Mitochondrial dysfunction, we use urine organic acid testing and serum pyruvate and lactate, ammonia. Remember, one of the jobs of the mitochondria is to help clear ammonia. We can look at CoQ10 levels in the blood, as well as serum total and free carnitine. The mitoswab test is a buccal swab test that looks at complex 1 and complex 4 of the electron transport chain, as well as an enzyme involved in the Krebs cycle called citrate synthase. Interventions. So basically, they fall into 4 categories. So improving the health of the mitochondria involves rehabilitating the mitochondrial membranes, which get damaged from things like seed oil, oxidized lipids, environmental toxicants that lodge in the inner mitochondrial membrane, detoxification of the toxicants that harm the mitochondria, balancing blood glucose. So the last presenter mentioned blood sugar balance and dysglycemia, insulin resistance. The high carbohydrate diets, especially simple carbohydrates without the presence of fiber, will lead to reactive oxygen species, which damage the mitochondria. Remember, the mitochondria are not protected by histones like the nuclear DNA. So they don't have bodyguards standing around protecting them. So they're very susceptible to oxidative damage. And then last, but certainly not least, stimulating mitochondrial biogenesis, or the production of new mitochondria. This is a really promising area. So rehabilitation of the mitochondrial membranes. They're made up of phospholipids, right? So we need to consume copious amounts of phospholipids: phosphatidylcholine, phosphatidylserine, phosphatidylenoethylamine. There's a product, and I have no affiliation with this company. It's just one that I've had great results with, and it's called NT Factor Energy by a company called Research Nutritionals. and the medical director is Dr. Debbie Hamilton. But this product helps to repair damaged mitochondrial membranes by reconstituting those phospholipids, displacing the damaged phospholipids with healthy phospholipids. And it also has the potential to displace mitochondrial toxicants like 2,4-D, as well as restore membrane potential. Remember, our bodies run on voltage, and that voltage, the biophysics, is what drives the biochemistry. With rehabilitating the mitochondrial membrane, it may take 4 to 6 months to notice a difference. So make sure you educate patients to trust the process and stay in it for the long haul. Detoxification of mitochondrial toxicants. So there's a laundry list of toxicants that damage the mitochondria. In fact, roughly 35% of all prescription medications damage the mitochondria. Some common ones are gabapentin, fluoxetine, statin drugs. There's a whole host of Levaquin, Cipro, the fluoroquinolone antibiotics, as well as glyphosate, mercury, lead, paraquat, DDT, 2,4-D, and mycotoxins. So it's not enough just to get the toxins out of the mitochondria. We got to excrete them out of the body. So this is where a systematic and systemic approach is important. So we want the bowels moving at least twice a day to keep phase 1 and phase 2 in the liver working well. We want to support phase 1 and phase 2 detoxification in the liver. We can do things like milk thistle, which supports both phase 1 and phase 2, calcium D-glucarate, glutathione, alpha-lipoic acid can be beneficial, glycine, which helps, is one of the amino acids that makes up glutathione, and then drainage support. So we want to get those drainage pathways open, and that's simply restoring normal physiological function. And that involves supporting the liver, the kidneys, and the lymphatics. So the lymphatics, I have a vibration plate in my house that I use for 10 minutes every day. That works to dislodge some of the toxins in the garbage disposal system, the superhighway known as the lymphatic system. Dry skin brushing also helps, and so do binders. So we want to get the toxins out of those systems, and then we want to bind them up so we can excrete them out of the body through the stool and prevent reabsorption. So things that you can do: infrared sauna. Full spectrum sauna is one I have upstairs. Near infrared, mid infrared, far infrared. Far infrared is going to help more with detoxification. Near infrared will also help with detoxification, and it penetrates a little more deeply. Frequency trumps duration. So if you can do 25 minutes in the sauna 4 days a week, that is much better than an hour twice a week. You want to make sure you shower right away. You don't want to reabsorb those toxins. You want to make sure you have a towel with you and you're wiping the sweat away immediately. The sauna is going to also increase parasympathetic tone, and it's also an exercise mimetic. So it can improve cardiovascular output. And let's remember, there's 2 ways to change the function of a protein: change the pH or change the temperature. With the sauna, we're increasing our basal metabolic rate and our core body temperature. That's going to allow all of our biochemical reactions to work better. Molecular hydrogen is one of my favorite therapies. I have a machine in the other room. You can use the devices where they have the nasal cannula, as well as produce the molecular hydrogen water, or you can use the tablets. Some need to be dissolved in water. Some can be taken directly PO or by mouth. But molecular hydrogen, what makes it unique is it's incredibly small. It's able to get into the cell and then into the mitochondria. It helps repair damaged mitochondria and stimulate the production of new mitochondria. And it's a very promising therapy. Most of the studies have been done in Asian countries, but there's really not one disorder that's been studied where my molecular hydrogen has not been shown to be of great benefit. Pulsed electromagnetic field therapy. So I mentioned voltage. We run on voltage. The biophysics drives the biochemistry. So PEMF, think of it as a workout. We go to the gym to work out. PEMF is like taking our cells to the gym. So it's going to restore that voltage. And if the voltage is restored, that allows toxins to get out and nutrients to get in. So oftentimes, if we use PEMF therapy first, it prepares the cells to receive the other therapies like molecular hydrogen, red light therapy, exercise with oxygen therapy, etc., hyperbaric oxygen therapy. So hydrogen, what does it do? So I mentioned how small it is and where most of the studies have been conducted. And it's been shown to benefit everything from cancer to glaucoma to mitigating cytokine storms. So obviously we had the pandemic with infections going around, and that creates a massive cytokine storm. Interleukin 6, TNF alpha, interleukin 1 beta. Molecular hydrogen helps to mitigate that. So it's a very potent anti-inflammatory. So holy hydrogen, the molecule that changed your life. So it helps prevent oxidative damage. It's going to help prevent DNA damage. It's going to expedite recovery from workouts, mitigate cytokine storms, reduce pain and inflammation, strengthen the immune system, and aid in detoxification. So it will make all cells except red blood cells perform more efficiently. It stimulates mitochondrial biogenesis, so we're making new mitochondria. And an important note is if a patient has hydrogen-dominant SIBO, small intestinal bacterial overgrowth, we may want to wait until we eradicate the hydrogen-dominant SIBO before administering the molecular hydrogen. So that's just a note of caution. Red light therapy. It was originally used in traditional allopathic hospitals for wound care. I have a colleague who still uses it for wound care, but now we know that it does much, much more. So the popularity has exploded. I've had my device since 2017. Most devices are a combination of red and near infrared. So red is going to be roughly 600 to 660 nanometers, and the near infrared is going to be around 800 to 880. So red light stimulates ATP production by triggering cytochrome C oxidase, which is the molecule that helps produce ATP in the electron transport chain, as well as nitric oxide. So it can increase perfusion to an area. Near infrared waves penetrate more deeply than the red light waves, but a combination of the two really helps to expedite healing from anything, not just orthopedic conditions. Have a transcranial photobiomodulation device right here that goes on the forehead like a visor, and it increases ATP production in the prefrontal cortex. So it's been used for everything from concussions to Alzheimer's. Even though here in the United States, we're not allowed to make those claims, we can just say it improves brain health, and that's it. So red light therapy, heal faster and look younger. So devices out there vary widely in terms of power and power output and the presence of non-native EMFs. So we're already bombarded with a lot of non-native EMFs, 5G, cell phones, etc. We don't want to add to that. There's a great book. I think it's like $9 or $10 on Kindle. It's called The Ultimate Guide to Red Light Therapy by my friend and colleague, Ari Witten. The three main mechanisms of action and how red light therapy works is it increases ATP production, hormesis, so it's a gentle stressor that prepares the body for future stressors. So you stress the system, you back off, you have adaptation, and then the system becomes more resilient. Retrograde signaling, so biochemical reactions, biochemical pathways, regulation of gene expression, etc. And if you want to check out the devices that are best, I highly recommend you read this book, The Ultimate Guide to Red Light Therapy. So the wavelengths are 630 to 680 nanometers roughly, and 800 to 880 nanometers. Those have the most research behind them. The power density, you want it to be at least 30 milliwatts per centimeter squared, and preferably closer to 100 milliwatts centimeter squared for certain distances. For example, if you're from 6 inches away. Duration of treatment depends on the power output and the intensity of the device, as well as the radiance. So it stimulates collagen, elastin, and most likely fibrin as well. Supplemental support, nutraceuticals to the rescue. So basically the three categories of nutraceuticals or supplementation that will improve mitochondrial function. Supplements that protect the mitochondria, provide substrates used in the mitochondria, repair mitochondrial membranes. Glutathione and superoxide dismutase. So we know glutathione is a powerful antioxidant, helps with detoxification, but it's also extremely important. It's a bodyguard for the mitochondria. So when glutathione production goes down, the mitochondria become more susceptible to damage. Every time we're exposed to a molecule of a toxin or non-native EMS, we use up glutathione. You can also have certain epigenetic polymorphisms where you don't produce or recycle glutathione as well as you should. So that's where glutathione comes in to protect the mitochondria as well as to help with balancing and modulating the immune system. The form that I've found that works best, at least for me and my patients and clients, is S-acetylglutathione taken on an empty stomach. I've had glutathione pushes, been getting them since 2006. And it's as close to a glutathione push as you can get. But the good thing is, patients and clients can do it at home. Liposomal glutathione, it's probably the number 2 in terms of supplementation. It's better than capsules, but in my experience, not as effective as S-acetylglutathione. The glutathione pushes work extremely well. You don't want to drip glutathione, and here's why. When you drip it, it gives your body a chance to adapt to the antioxidant. So it's working on achieving a dynamic equilibrium. When you push it, it overwhelms the oxidative stress. And I've had it both ways, and it's night and day difference. Trust me on that. Superoxide dismutase. It's produced by our bodies, but most people are deficient. And it's like the partner in crime, but in a good way, with glutathione. So it helps protect the mitochondria. And if you've seen those commercials where Cindy Crawford has her skincare line, the entire premise of that skincare line is on the melon from the south of France that is extremely high in superoxide dismutase. So certain foods, cruciferous vegetables may be used to increase superoxide dismutase levels. Things like broccoli, peas, spinach, honeydew, cantaloupe, Brussels sprouts, cashews. You can also have it administered in an IV form in a clinic. And then there are some supplement companies that claim to upregulate superoxide dismutase, and it's good for catalase. I don't know if there's any data supporting those supplements, but definitely the foods included, as well as IV administration, has been proven. Coenzyme Q10, it's an antioxidant powerhouse, but it's important for ATP production. We can measure it in the blood. We can also measure it on an organic acids test, which is how I like to do it. And we produce it endogenously in the body. And it's important for the electron transport chain. It's fat soluble, and since like dissolves like, we want to take it with fat. It helps to regenerate vitamin C and vitamin E. And the most metabolically active organs are the heart, the brain, the kidneys, and the liver. So that's, if you start having mitochondrial dysfunction, the first place it's typically going to show up is in the brain, and then secondly in the heart. The heart has a higher concentration of mitochondria. The brain has about 5 to 8% of the body's total mitochondria. However, it utilizes 20 to 22% of the body's oxygen that we consume. So, like I said, it needs to be taken with food, preferably in 2 equally divided doses per day. I would say you want to use at least 100 milligrams BID for patients to notice a benefit. This is especially important for people on statin drugs. It's a requirement. It's not optional. And in terms of it benefiting cardiovascular function, it can help improve cardiac output. It's going to help prevent lipid peroxidation, so damage to the cellular bilipid membranes. And it can also be used to support fertility. Methylene blue. So methylene blue has been around for a long time. It increases the efficiency of complexes 1 through 3 in the electron transport chain by 110%. That's a lot. It also has some very strong antimicrobial properties and anti-aging properties. And since the brain is a very metabolically active organ, it has strong antidepressant effects. So the previous presenter mentioned NAD. NAD is great, NAD is like putting more gasoline in the gas tank. Methylene blue is like fixing the engine. So two different mechanisms of action there. Has anti-aging properties. It can be administered intravenously, a buccal lozenge, or even a compounded capsule. And most recommendations say to start around 40 to 80 milligrams per day. Some relative and absolute contraindications to methylene blue. You have to measure G6PD, see if someone's deficient in that. Those individuals should not take methylene blue. Also, some concerns may or may not be warranted for individuals who are on SSRIs, and of course, women who are pregnant. When you stimulate mitochondrial ATP production, all these reactions that have been offline and deemed non-essential to keeping you alive suddenly turn back on. You may start dumping toxins. Additional supplemental support, vitamin C. So human beings, anteaters, and if I remember correctly, elephants cannot produce vitamin C endogenously. So we need to supplement with it. Vitamin E, it helps also prevent lipid peroxidation, so damage to the bilipid cellular membranes. Sulforaphane, boswellia, PQQ, resveratrol, and oxaloacetate. So oxaloacetate is a molecule that's produced during the Krebs cycle, so it can help facilitate ATP production. Resveratrol activates some of the Sirtuin pathways, and boswellia is a potent anti-inflammatory. So other supplements that may be helpful, L-carnitine transports fatty acids into the mitochondria so they can be burned through beta oxidation. But depending on the composition of the gut microbiome, we may need to limit someone's intake of L-carnitine or stop them from taking it altogether. You can measure TMAO levels in the blood. TMAO is a molecule that increases the risk of heart attacks and strokes. So while L-carnitine is great, you want to try and optimize the microbiome first and then monitor other blood markers like TMAO, lipoprotein A, apolipoprotein B. Another compound that's been out for the past 4 to 5 years is urolithin A. It stimulates mitophagy, which is the cleaning up and the repairing of damaged mitochondria. It's derived from oligotannins, which are metabolized by the gut microbiome. So oligotannins are found in certain fruits like pomegranate, raspberries, strawberries, and some nuts. However, most people, around 70 to 80% of the population, do not have the correct microbiome composition to help facilitate the conversion to urolithin A. NAD plus is a coenzyme found in every cell in the body. As the previous doctor mentioned, as levels drop, our frailty increases and our functionality decreases. It's involved in several hundred biochemical reactions. It can be used in an IV drip, transdermal patch, or taken by mouth. Environmental changes that benefit the mitochondria. Make sure you have your home and office tested for mold and mycotoxins. Mycotoxins affect every system in the body. They block the NRF2 pathway in the mitochondria. So if you test positive, you want to have your home or office remediated. But you also want to keep humidity down. So behind me, I have a dehumidifier running. I have one running upstairs. And I also have an air doctor, which is an ultra HEPA plus carbon air filter, because things like mycotoxins are very, very small particles, and most mycotoxins we can't see or smell. So I've gotten to the point where I stop asking patients if they smell mold in their house. Most people are going to test positive even if they don't smell. Open your windows twice a day to get some fresh air, unless you're in a highly polluted area like Los Angeles here in the United States. Environmental changes. So EMFs. So we have the Schumann resonance, which is a natural EMF, and it's good for us. Non-native EMFs are from dirty electricity, cell phones, 5G, laptops, etc. And they flood your cells with calcium. They activate the voltage-gated calcium channels. And that leads to the production of peroxynitrite, which is very inflammatory and can make you feel quite poorly. Some simple tips: turn off Wi-Fi at night. You can use grounding bags like this one. There's a guy named Justin Franson from EMF Rocks. No affiliation, but it's a grounding bag. And Lamb's clothing helps to block some of the non-native EMFs. And Faraday bags for your cell phones when not in use. Paint is also available that can help mitigate non-native EMF levels in homes and offices. Cold plunging, so shivering your way to metabolic health. I learned about this from neurosurgeon Dr. Jack Cruz. Basically, you're activating brown fat. So babies have an enormous amount of brown fat. When we call baby fat is brown fat, and it's mitochondrially dense. If we don't have deliberate cold exposure, Dr. Tom Seeger, who I just interviewed, he says by age 45, we essentially have almost no brown fat. So it works by stimulating the mitochondria, cold shock proteins, downregulating inflammation, and a whole bunch of other pathways that we're just now discovering. It also increases dopamine several 100%, along with norepinephrine, thus improving mood and focus. So around 11 minutes per week is the general consensus. Temperature requirements, you want to start with something around 50 to 55 degrees Fahrenheit, gradually work your way down, and then you never want to go below 34 degrees Fahrenheit. And if you have hypertension or cardiovascular disease, that is a contraindication to deliberate cold exposure. PEMF, or recharging your batteries. So all dysfunction ultimately happens at the cellular level. So we're changing the voltage at the cell membrane. It's, like I said, it's a workout for your cells. It can help with pain, fatigue, detoxification, fractures that are recalcitrant to healing. And remember, we're bioelectrical beings, and the voltage drives our biochemistry. Nutritional support for the mitochondria, low glycemic diet. We want to avoid insulin resistance because that contributes to mitochondrial dysfunction. And even too much fruit may lead to mitochondrial DNA damage. So context is important, but we want to evaluate the level of insulin resistance present. Detoxification of mitochondrial toxicants. Like I said, get the bowels moving 2 times per day, support liver phase 1 and phase 2, get the lymphatics, kidneys, and liver moving.
2 minutes to go, sir. Yeah.
Okay. So summary. To optimize your mitochondria, optimize your environment. That includes purifying your air. Remember, we breathe 12 to 16 times per minute, times 60 minutes in an hour, times 24 hours in a day. Got to make sure we're breathing clean air. Decrease artificial blue light exposure and increase red and near infrared light exposure. Use positive environmental inputs like sauna, PEMF, molecular hydrogen, cold plunging, and other tools. Provide optimal nutrients. So molecular hydrogen, methylene blue, NAD+, CoQ10, urolithin A, L-carnitine. Positive mindset and balanced blood glucose levels.